Do you or someone you know deal with a deadly disease that not only affects them but their loved ones? Today, I'm here to talk to you all about type 2 diabetes. I want my audience to understand the three major topics when dealing with type 2 diabetes: the facts, treatment and care, and a proper diet. I chose to talk about this topic because I have family members who deal with this disease, and I also had an auntie who passed away from complications of type 2 diabetes. I will start off by explaining the facts of the type 2 diabetes. My first point is knowing exactly what this disease is. The cause is that the body either does not produce enough insulin or the body ignores the insulin altogether. It is the most common form of diabetes in America, and according to the American Diabetes Association, in 2012, 9.3% of Americans had type 2 diabetes. Even though everyone in America can be affected by this disease, some groups are at higher risk than others. These groups are African Americans, Latinos, and Asian Americans. And according to the Center for Disease Control and Prevention, the percentage of people ages 20 years old and above with diagnosed diabetes between 2010 and 2012 were whites with 7.6%, Asian Americans with 9%, Hispanics with 12.8%, African Americans with 13.2%, and American Indians and Alaskan Natives with 15.9%. My second point is the treatment and care of type 2 diabetes. Blood glucose testing and medications are the two ways to help monitor and control blood glucose levels. For my second visual, it shows exactly how to check your blood glucose levels. You can prick your finger to make the blood come up. You put the test strip to the blood. You can either put the test strip in the monitor or already have it attached to the monitor. You wait for the number to pop up, and once the number pops up on the monitor, you write that down in a log book, anywhere you can keep it, and save it for your doctor's appointments to show how well you're doing with monitoring your blood glucose levels. You can also be prescribed medicine to also help with insulin or any other complications that come with type 2 diabetes. There are 20 plus types of insulin sold in the US. However, most insulins are made to help produce insulin for the body or automatically put insulin in the body. Another treatment for type 2 diabetes control is meal planning, weight loss, and exercising, which brings me to my third and final point. This point is having a healthy diet with this disease. According to WebMD, the top 4 things to worry about with a diet is carbohydrates, fiber, fat, and salt. Carbs give you energy, however, they do not last long unless you eat complex carbs. Counting carbs and splitting them between your 3 meals per day help keeps your blood sugar down. Fiber is the best thing to have in your diet because not only does it help with digestion, it helps with your blood sugar levels and it fills you up longer so you don't eat meals throughout the day. Limiting fats, specifically saturated and trans fats, help you lose weight because saturated and trans fats are in baked goods, chips, soda, all the fattening foods that helped you gain weight in the first place. And limiting salt helps keep blood pressure down. In conclusion, I hope everyone was able to understand type 2 diabetes and the 3 major subjects about it: treatment and care, the facts, and a healthy diet. I personally dealt with this disease because I have a lot of people in my family who have it, and unfortunately I lost an auntie because of the complications from it. Now I hope with this information you all take it home with you. Tell your family and friends how they can prevent themselves from getting type 2 diabetes or how they deal with type 2 diabetes if they have it. It is very important that we all remember how to deal with this disease. That way we can prevent it in the near future and just kill it altogether. Thank you.